I'm Ashley Anderson here with Dr. Robert Harrell of the Harrell Dental Implant Center. Thanks for joining me.
Thank you. Glad to be here.
For patients who are missing multiple teeth or need a full set of dentures, they have a couple of options. The snap-on denture is one. Can you explain that?
For many patients that come in, we start with a cone beam scan to evaluate what type of bone they have. So we look at the availability of bone, the quality, the dimensions of the bone. Some of those patients are not candidates for an all-on-4 procedure, and that's typically due to lack of bone being available. For those patients, we look as another great option to do what we call a snap-in denture. Snap-in dentures can be done with minimal available bone because we can place smaller implants, and we typically will locate as many as 3 implants per jaw. And then the snap-in components are built on top of the implant, so we have a snap head that screws into the implant, and then inside of the denture there is a receiver, so a little gasket that snaps down over top of the snap, so almost like a snap would work on a shirt. And so those patients really get that comfort and that stability. When the teeth go in, you get to feel and hear that click click, and that's when the dentures actually attach to the implants. In cases where there's not enough bone available to do on an all-on-4, or sometimes patients may choose a snap-in because the cost is lower, it's still a great option, and we do lots and lots of snap-in dentures in our practice, and patients love them. They love the security and the stability to be able to really eat what they want and smile with confidence and know that they don't have to use these messy adhesives anymore, and their teeth aren't going to be moving around while they eat.
And the other option you mentioned was the all-on-4. How does that differentiate from the snap-on denture?
The all-on-4 is a permanent replacement option, which basically means once the implants are placed, the prosthetic teeth are screwed into the implant. So the patient is not able to take that out. It's not a removable option. We are able to remove the all-on-4 prosthetic if we need to for cleaning, if we need to check it or do any type of service, but on a day-to-day basis, the patients will brush and floss them just like natural teeth. They're going to look very much like natural teeth. We make them with a porcelain material that's reinforced with zirconia, so they're incredibly strong, very lifelike, and patients can really eat with the comfort that is provided by that all-on-4 prosthetic.
Dr. Harrell, thanks for your time today. We've learned a lot of helpful information today, and I hope you at home learned something as well.